All right. Good afternoon, everybody. Welcome to the weekly Facebook Live update. I'm Justin Westmiller, Director of Homeland Security and Emergency Management here in Sinclair County. And with us, as always, is Dr. Annette Mercatante, the Medical Health Officer for Sinclair County. Welcome, Doc.
Hi, that's my queen. That's my queen wave. Okay, sorry.
Let's get right into the data, Russ. All right. Totals to date: 14,125 total cases, 608 total hospitalized, 293 deaths, 8,888 total recovered. Changes in the last 7 days: 1,866 new cases, 267 average new cases per day, 659 tests per day on average, and a staggering 30.2% positive on those tests. That is the highest number we've had so far in the county. Here's our case charting. As you can see, we are in a terrifying race upward still. We have not plateaued. We're still moving upward. And there'll be more to follow on that. I think Doc's going to talk about that just a little bit here in a minute. This is our percent positivity. We just talked a minute ago that it's 30.2% currently, and that we're averaging a little over 650 tests per day right now. This is our vaccination count. So far, we've put out 63,000 and some change for vaccines. And really good news for our 65 and older, we are at 58% vaccinated for those 65 and older. And for residents, we've got about 30% coverage for all residents in Sinclair County. And then, as always, you can find our up-to-date dashboard link at sinclaircounty.org/offices/COVID-19.aspx.
Okay.
All right,
just add
Jen?
that.
Oh, go ahead.
I'll just make a comment about that data. That is 23 more deaths since last week. And obviously, everything is higher significantly for the last. We've been going up steady for how many weeks now? Does anyone have that right in front of them? Steady since, since the beginning of March, it looks like. So, anyways.
Yeah, 7 or 8
Go ahead,
weeks.
Jen.
Okay. Hello, everybody. Doc, could you just go over, discuss, because this seems to be a common question, this is just a talking point, discuss why St. Clair County and the Thumb region is so high right now. What's it going to take to improve this situation?
Well, we will go down. Just epidemiologically and historically, viral surges go up and they come down. How long that'll take and what the damage will incur in the meantime remains to be seen. So the why, that's a great question. I don't think we really know the answer for sure. It is a combination of variants. We may have been an unlucky fertile soil for variants to land, because we also have a much higher percentage, and I can't tell you exactly what percent, but we have a lot of non-compliant behavior with viral mitigating strategies. And we got a late start in our vaccine. So we're way far away from what we need as far as a vaccinated community to provide that kind of slowing. So maybe just the wrong place at the wrong time with the wrong variant. Unfortunately, that's about the best I can tell you right now.
Okay, thank you. Justin, could you talk a little bit about COVID testing? Just
Absolutely.
Remind people about that.
Testing is still going to be our most critical capability in slowing this positivity spread that we're having, especially with the variants that are running around our county. We know of at least 2 variants that are running around our county, with one being pretty prevalent. So there are many local providers, as well as the health department, that are running tests in our county. The health department is offering testing Monday through Friday at an off-site clinic located at 1168 Gratiot in Marysville. Appointments can be self-scheduled on the health department website, and that's sechealth.co, or you can call them on the telephone at 810-987-5300. You can also find testing on the coronavirus website. Just type in MDHHS in your search bar and then /coronavirus, and you can find their testing website on that site. You can find testing anywhere in the state.
And I'll just
Thanks,
add as
Justin.
well that we are rapidly and as quickly as we can trying to expand not only our own capacity of testing, but bringing in other testing processes into the county. So you'll hear more about that as soon as we got them set up.
Hey, Doc, would you talk about the partnerships that we have right now going and what we can possibly see in the future with vaccine partnerships?
And I think when you look at the vaccine graph, one of the things that strikes me is that we've got more and more vaccines, and now the last couple weeks, we've plateaued. So as far as what health department staff with our army of volunteers, and first of all, big shout out to all of you volunteers. We've kind of maxed what we can do at these clinics, and we'll talk a little bit about the clinics in a minute. So we need partners to vaccinate. And so far, we've had some great partners, not only our pharmacies, our Myers, our Walgreens, our Rite Aid, but in Kroger's, but also Wadham's and Hamzavi pharmacies. I think there's VG's in there as well. And also our community partners. We have a Marysville Fire, Richmond Lennox EMS is helping us out a great deal. CMH, thank you, Deb Johnson and her crew for putting a vaccine clinic on. I'd be remiss to not say SCC Better Together. Our diversity work group has been working really hard and putting clinics on the south side. So it really does take a village to do this. We're going to not only have to have our ongoing large clinics, but really try and focus on special communities, special locations to try and get this vaccine out to as many people as we can.
Okay.
Did I miss anybody? Jen, did I miss anybody? Okay.
I think you got them all that I can think
right.
of. And then the now vaccine closed clinics that are going to be happening for businesses through the Blue Meets Green project.
Special shout out to Blue Meets Green. They've been stepping up the plate and really helping us out a lot. Dan Casey and his crew. Really, it's all hands on deck, people, and I really do appreciate. If you're considering volunteering, please go to the My Volunteer Registry. That provides us a vetting and liability process, but we'll pull you out there and we'll use you locally. So even though it's a state registry system, you'll be used locally by registering there.
All right, let's start with some questions that we got last night. Justin, can you give an update if COVID is still felt to be surface borne? So do we still need to disinfect every surface people touch?
So the CDC came out and gave some guidance that you do not need to clean every surface that you touch. The only time you need to go in and disinfect surfaces is when there's a known COVID sickness in that area, or there's believed to be a known COVID sickness in that area. Then you should go back and disinfect that area. You don't have to go and clean up after someone's been there every single time. That is not required any longer. And that just came out less than 10 days ago.
And if people still want to, can they still do that? They choose to?
Absolutely, sure. I mean, that's just extra cleanliness, right? But it's not required to go back and disinfect every space just because a human being's been in there.
Okay, thank you.
And that is because we know now that that's not a common way of disease transmission. Right.
Okay. Doc, this question is for you, and it's kind of several different questions this person had, but it's also in front of you. How many fully vaccinated people have been vaccinated 2 weeks past their final vaccine who have tested positive for COVID-19 in St. Clair County? That's the first part of the question.
Okay. Well, first of all, you didn't give me this data, Jen, so you're
I
throwing
don't know.
me under the bus.
Sorry.
I don't know how many fully vaccinated people do we have? 30%? I don't remember.
Yeah, it's close to 30%.
30% fully vaccinated, because the data you showed, Justin, was any vaccination. So, yeah,
actually,
so it's less than 30%.
It's close to 20%. It's close to 20% fully vaccinated. Yeah.
So I apologize. I don't have that in front of me. We also don't know exactly how many people have been diagnosed with COVID after being fully vaccinated. But I can tell you this, that data is being looked at throughout the nation as well as the state, and the number does not exceed what we would expect. So these vaccines are about 94, 95% effective. And in fact, the number of people who are getting infected after fully vaccinated is actually way less than the 5% you'd expect. It's way, way less. I think the numbers I'm seeing are less than 1%. So
It is.
I
have some numbers for you.
Okay, go ahead.
So
yeah,
as of April 1st, in the state, there were 243 breakthrough cases, and that makes it 99.99991%, right? 243 cases is nothing when we vaccinated 1.7 million in the state. And I know that because the state gave us a brief today.
Yeah, but
Thank
do
you.
understand that those are known cases. So,
Correct.
Give yourself a little slack there. The point is it's way less than the 5% we'd really expect from the clinical trials.
Yes.
So good news. The vaccine is as effective as they anticipated.
So the rest of the person's questions then probably can't be answered at this time then.
Well, I do know that we've talked to Brandon, even though our data guy's gone, and boy, do I miss you, Brandon, if you're out there having a relaxing time, and I hope you are. And he's not gone because he's sick. He really is trying to take a break, as we all will, as will I be soon, by the way. Heads up, I can't do this forever. I'll be back. There are no deaths, none, that have been vaccinated. Zero. And I believe the hospitalizations, I don't think we have an actual final, but I don't believe there are hardly anybody that's hospitalized. When I say hardly anybody, I think it's less than maybe a couple in the dozens and dozens. So that's the good news about that, is the deaths are zero for deaths that have been vaccinated. And the last question I see here, I'll just ask it. Have you done contact tracing on these people? What does he mean by these people? The people who've been hospitalized or people who've been infected after being fully vaccinated?
That.
Yeah.
Latter part.
Yeah. They go into a special investigation process that the CDC is collecting. And so they are a priority group for us. If we know about you, you'll be a priority for us to do a case investigation on.
All right. Thank you. Justin, this person says, I have heard some animals, such as dogs, getting COVID. Is that true? And if yes, how is that transmitted? Or is that just a myth?
So there has been a handful of cases where animals have gotten it. We heard of one case in the Cincinnati Zoo where actually a tiger got it. There's been another case where I think they found a cat that had it. Every once in a while, this does happen where an animal will get it. I haven't actually heard where a dog got it, but it's not out of the realm of possible that an animal can catch it because it is a respiratory disease. So again, I haven't heard that has happened with a dog, but animals it has been passed to.
Okay, thank you. All right, Doc, if you have a positive test, is it recommended to get a follow-up test to make sure it comes back negative, or will it always show up positive?
Oh my gosh, sometimes I say the same things over and over again. So some people will continue to have positive tests for a prolonged time after being tested, particularly with the PCR testing. So when I say some, I don't have an exact number, but it's not everybody. It's a small percentage. Is it 10%? I can't remember exactly the percentage, but it's small, but it's enough that we don't really want you to get retested because it's meaningless. If you have a prolonged positive test, it does not mean you're still contagious in most circumstances. Now, if you're immunocompromised and you're still sick, that's a whole different story. Those are very rare situations. So basically, if you have tested positive or you have been sick and test positive, you want to wait the 10 days until you've recovered before you can assume you're no longer contagious. At 10 days, 99.99% of individuals are no longer shedding live virus that can infect other people. So getting a repeat test is meaningless. nor does it of any value to get a negative test 2 days after you get a positive test, because you're still contagious. I don't care what that negative test says, because tests can miss the virus as the viral load goes down. If it's not, the viral load's not high enough, your test can be negative. So please, our recommendation is do not retest. If you've been positive, just isolate for 10 days, make sure you're feeling better, and then go back out in the world.
Okay, thank you. Justin, will there be Saturday appointments opening soon so my husband who works can get in? He can't come during the week.
Sure. So right now, the health department clinic is on Wednesday and Friday. Like Doc said, community mental health is holding a Saturday clinic. And I don't know if they're doing repeat clinics, but we do not have a plan currently to do Saturday clinics, but that doesn't mean by next week we won't have a plan to do clinics somewhere. We're working through that right now, and there'll be much more to follow. We're working through our allotments and trying to figure out how we're going to make different clinics happen in different areas, just as Doc said. So there'll be more to follow on Saturday clinics and weekend clinics.
Yeah, I'm asking the question because I know we have several Saturday clinics in the hopper. I just don't know if they're ready to go, if they're by appointment, or whether they are. I
They're
think
by
the ones that
appointment.
are set up are by appointment.
Yeah.
So again, if you want a vaccine, pre-register in our system, because as these options become available, these organizations say, okay, we're taking the names from our registry and scheduling them for those clinics. So it's a good place to go still, regardless of your age or remember, everybody's eligible now. So go ahead and pre-register in our website. It's very helpful.
And then also remember that our clinics are open till 7 o'clock at night. So even if you can't get there, from 9 o'clock until 5 o'clock, if you can make it there after work, we're still staying open until 7 o'clock for those people that are working during the day.
Okay. Next question is, my husband got COVID after his first shot. They told him to wait 90 days to get the second shot because of the antibodies it could give him.
Right.
When I didn't get tested, when quarantine is up, can I still get my second shot on time?
Yes. So we only ask people to wait 90 days after they receive a monoclonal antibody therapy for COVID. Everybody else can get vaccinated on time. If you happen to get sick with COVID in between your first and second shot, all we're asking you is wait till you recover. Wait till those 10 days are up and you're no longer in isolation. So the 90 days is only for people who've received COVID monoclonal antibodies for their COVID disease.
Thank you.
Mm-hmm.
Justin, any word on when the vaccine will be available for 12 to 15-year-old children?
Yeah, so you saw last week, I think 10 days ago, Pfizer put out a press release saying, hey, we have really good data that says our vaccine is good for 12 to 15-year-olds. Now, that's really great news, but it hasn't gone through the regulatory process with the correct folks within the U.S. government. So that process, the EUA process, needs to be done before it's allowed to be given to the 12 to 15-year-olds. So we still have to go through the entire vaccination or vaccine authorizing process before that update can be given to the EUA so that it can be given to the 12 to 15-year-olds.
Okay. The next question is, if you have allergies, is it safe to get a COVID vaccine?
Yes, unless you've had a severe reaction to a COVID vaccine. So if you've had a severe reaction to your first dose of COVID vaccine, we're probably going to advise you. When I say severe, I mean anaphylaxis, difficulty breathing, things like that. We're going to advise you not to get your second COVID vaccine. If you've had some milder symptoms with your first COVID, we'll have a conversation with you and decide what your next strategy is. But if you have allergies to anything else, you can receive a COVID vaccine.
Okay. Next question, where can I get the Johnson & Johnson vaccine?
Friday at our clinic. Friday.
Yeah.
And by the way, this is a good time to segue. So the good news is that long pre-registration system that we set up for you guys a couple months ago, and we had thousands and thousands and thousands of people in it, we've gone through the whole list. Okay, everybody who's there has received at least an appointment If you haven't, send us that COVID. It's because we didn't have a number or something for you. We've gone through that list actually several times, and we'll continue to send out invitations. But what we're going to do, we couldn't fill our Friday clinic. Okay, that's good news. So we're going to do the first part of the Friday clinic by appointment, and the second part from 1 till 6 p.m. we're going to offer walk-in. Where this press release is going to go out right after this. But if you want to get a J&J vaccine, come at between 1 and 6 p.m. at the Marysville Knights Club. Couple things to keep in mind. If you have an appointment there, keep the appointment time. This announcement doesn't apply to you, so please keep your appointment time. But if everyone else is not scheduled, you can come. If you're sick or not feeling well, please don't come. Okay, we don't want to spread COVID. We don't want to spread the love when we're actually trying to prevent the spread. It is the Johnson & Johnson on Friday. We don't promise every clinic to be J&J, but we did get a shipment of that. We want to use it. The nice thing about J&J is it's a one-time dose. So you don't have to come back a second time. It is 18 years and older. We want people who work or live in St. Clair County to take advantage of this. We are not checking IDs to make sure that that's true, but we encourage people from St. Clair County to take advantage of this. We have over 1,000 doses to administer. So once those doses are gone, we will stop providing vaccine. Okay, so this is not an unlimited supply. We will be handing out forms in the parking lot. Since we don't have an appointment, there's no pre-registration process, you're going to have to fill out all that paperwork when you get there. We're going to try and have you do it in the parking lot while you're waiting. There is no out-of-pocket costs, but do bring your insurance card because we can recoup some of those administration fees if we can, but you will never see a bill for this. Please wear your mask, and when you come there, keep your mask on and keep yourself 6 feet away. Russ, is he paying attention?
Cue it, Russ.
Chris, see that graph? You have a high rate of exposure going out in our community right now, doing anything. So please, 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 don't come if you're feeling ill. Don't come if you've been exposed to someone who you know has got COVID. If you're in quarantine, please don't come, okay? Wear your mask and stay 6 feet apart. Thank you, Russ. Told Russ every time someone asks me why, I'm going to throw that thing up there. There you go. Social distancing. If you get there and the parking lot is full and there's a big line, come back later. I've already mentioned that we have lots of vaccine clinics in the cooker. We're going to have lots of opportunities for you to get vaccinated. So don't put yourself at risk or get yourself all flustered by that. Okay. Done.
All right. Great. All right. The next question is, somebody asked last night, if people are getting vaccinated, why are numbers rising so high?
Russ. Because it's a terrible virus. The variant in particular is at least 50% more contagious. It's unforgiving. Before, if you kind of messed up with your mask or you messed up with a quarantine, we could get away with it. We're not getting away with it with this virus this time. It's brutal. And people are not paying attention. Let's face it. I can tell you the countless number of times I've received notification that people are just not paying attention. They are done. We're done with this. Okay. The virus is not done with us, but a lot of people out there are. So I'm going to go back to what Justin said about testing is important. What is more important is protect yourself. If you care still about this, and I hope you are, if you're watching this, I'm hoping you still care. If you care to not spread this virus, still do the things we've talked about and get vaccinated. The number one thing we can do right now is get as many people vaccinated. Because going back to the question, we don't have enough people vaccinated yet to stop the transmission. The virus still has way too many vulnerable people that it can land on and infect. And until we have that herd immunity where the virus lands on a few people and can't infect them and then just goes away, where's that herd immunity going to be? It's going to be upwards of 80%. Okay, because this is a very contagious virus. So we have to get vaccinated. Get your vaccine. That's what's going to help.
Thank you. Somebody asked, is it safe to get the vaccine while pregnant?
You know, the studies have not specifically been done on pregnancy. They are doing them and they have not been released yet, but there has been no red flags. There have been no adverse pregnancy outcomes related to the vaccine. Where there have been adverse outcomes related to getting infected with COVID. So we go back to risk benefit. If you are pregnant and particularly working in an environment where you cannot avoid being exposed and getting infected, talk to your OB, but we would advise vaccine. The other thing about vaccine that we do know of, these are not live vaccines, and there is no theoretical risk to getting vaccinated with these types of vaccines. There are no reasons we can consider that would be a higher risk to a fetus, where we do know there's higher risk to a fetus getting infected. So more to come on that, but the good news is no red flags. All the VAERS, all the post-surveillance systems that we have in place are not indicating a problem with the vaccine, okay? So
Thank you.
that's good news.
And the last question from last night was, do young people die from the UK variant?
Young people die from all the variants. It's rare, but they do. I don't have the numbers in front of me, but I can tell you, yes, young people do die. It's just not as common as old people. So it's not like if you're 15 and healthy, you're off the hook. Okay.
All right.
Not to mention you can spread it. Go.
Thank you. Okay, we're moving to the live show questions. This person's asked, they have opened up the vaccine available for 16 and up. Why in St. Clair County no appointments are available? I've tried Walgreens and Rite Aid, all say no appointments.
We're doing 16 and 17-year-olds. Sign up on our website. Every time we have a Pfizer product, we're doing them. And in most of our clinics, we're bringing Pfizer and Moderna both. So if you're 16 or 17, you'll get one, and we'll do the other if you're other. So please sign up on our website. Maybe the pharmacies you're signing up for don't have Pfizer. Remember, it's only the Pfizer product that's approved for 16 and 17-year-olds. And by the way, we're working with schools to try and open that up as well. Lots of discussions about how to get vaccine clinics going in the school. So you'll hear about that hopefully very soon. More opportunities to do that.
Okay. The next person just wanted to reiterate, if anyone goes to community mental health, they are giving shots on Saturday. Call to register. It's free.
Thank you.
Somebody wants to know, are they closing anything other than the schools?
No, and we're not closing schools. Schools are pausing at our advice, particularly if they have cases in their schools, and each school board is making that decision based on the internal events going on. Got to remember, schools, and we have been talking to schools consistently through this, and when schools start having trouble, they're usually the first ones to raise the red flag. They're having trouble with subs. They're having trouble with teachers. They're having trouble with lots of cases and lots of quarantines. So this doesn't happen in a vacuum where we wave a wand and say all schools are closed. We just know, Russ.
Cue it, Russ.
We know this. This is not a great time to be sending our kids out in communities and clusters. Now, if done right, we know that kids can go to school safely, but right now is a really dangerous time. And so we would like to see this peak. We'd like to see a plateau here and give everybody a chance to get out of quarantine, especially those staff members. After spring break, there's a lot of people in quarantine and isolation, a lot of positive people, and that means a lot of quarantine people. So it's just a problem time right now. So we have recommended pausing if schools are struggling with that. We have recommended people to work remotely as much as possible. And we have recommended people to not do indoor dining, but no, there have been no formal bans or orders of the same.
And
we just want people to do the right thing. Go ahead.
Yeah, and so we had a conversation earlier, and I said this: if we had 30% positivity for the regular flu, for the common flu, we would also be highly recommending all of the schools to take a pause, because it would be unsafe to bring all the students and staff into the congregate setting too. We would be in the same boat. Now, with COVID, it's much more dangerous. It's much more impactful to do that. So these decisions would be made in the same sense with a different disease, but this one is much more dangerous.
Thank you.
Jen, we're going to have to go a little past 4 if we're just getting to just saying.
Yeah. Okay.
Okay.
Yeah.
All right. Next question. Are there concerns that people are not able to get their appointments because of lack of transportation, especially outlying communities like K-Pac and Memphis, for example?
Yeah. Yeah. Working on that, doing our best to get clinics out that way. We do have the transportation people helping us out. So always an issue. Barriers are always an issue. We're going to keep working on them until we can get everything done.
Next question. Is this variant more deadly than, excuse me, my phone just cut me.
It's a variant more deadly than the original. It's not,
Yes.
we don't know for sure. It's probably not more deadly, but here it is. If it's more contagious, more people will get it. And if more people get it, even though the same percentage of people will get seriously ill, that will be more people seriously ill. We didn't touch on this, but yes, we have a problem right now with the amount of people who are requiring hospitalizations and more advanced medical support. We got a problem. So we need to keep people out of the hospital, which means we need to try and keep people from getting infected. And again, vaccine. Even if you get sick after a vaccine, it's much more likely you're not going to get hospitalized and die.
Okay. This is very weird, but my phone cut me off and now it's looking at other things.
I'll read them.
Go ahead. Let me see if I can get back on.
Amanda Schneider says, so why is it that people who are fully vaccinated are getting COVID so bad?
They're not.
Yeah, I agree. They're not.
There may be a few, but they're not statistically the way unvaccinated people are.
And then the next question is, how many vaccines are given weekly in Sinclair County?
We have that number, 8,000, something like that. That's both first and second doses, but we're trying to get 4,000 to 5,000 first doses out every week, which is kind of our max capacity. And then as we add these other community groups, I'm hoping we can add a couple thousand to that as well.
And then have you noticed any different symptoms with the B117 variant versus the original strain?
Nothing published that I know of. Anecdotally, I know that ER docs are talking to each other. This is a weird virus. It's going to take us a while to know for sure. But yeah, one thing we do know, it seems to be infecting younger people, and that may be a component of the virus and how it's spreading. We know this, at least the front end of this curve started with when things opened, and it started up with a lot of outbreaks in sporting events and sporting teams, young people. Again, I'm sorry, I don't want to throw you under the bus, but it was a lot of that. And now it has spread more to the older age groups, but it's still in a younger group than what we saw in that second wave. The other piece of that would also be perhaps that we got more older people vaccinated in the initial part of this campaign, and so that might be protecting them more. But that's the only thing I know for sure.
Justin, read the next one, because for some reason I'm not seeing some of these.
Sure, got it. With all of the private schools having students returning from out-of-state trips, will you mandate that those private schools go virtual for at least 2 weeks? So again,
we didn't go with that. We didn't mandate, but the private and parochial schools got the same strong recommendation that all the public schools did. They got the same recommendation.
And then I'll take the next one from Sheila. Justin, do we know what variant we have if we test positive? It probably doesn't matter much, but I was curious to know. And so the answer to that is when we do PCR testing, a certain percentage of those PCR tests that are sent out go to the lab and get sequenced for which variant it might be. And then those, if it hits for a variant, it gets sent back to the health department so that it can be further investigated. So if you do have a variant and you are in that percentage, then we might know.
We are, again, that's a priority area. If we get a variant back, you will be notified. Just a little anecdotal story. We have a lot of people who have variants who are not cooperating, who aren't talking to us, who are not telling us who has been around them, etc. So just another little why us, Russ? Why us? You gotta work with us here, okay? It's really important that we do the right thing. Okay.
And everybody, we're having a little fun with it, but we're in trouble, and we're trying to prove the point that we're in trouble. We don't want to be this high, and we need everybody's help to not be this high. That's the issue. So
that's what we mean. Yeah, I don't mean to be making light of it either. I just, when people say why, I'm like, yeah, this is intense. It's very intense.
It's hard.
Go ahead and ask another question. It's hard.
Yeah, there we go. So you got it, or do you want me to do it?
Go ahead, because I'm not seeing what you're seeing. Go ahead.
That's okay. People that opted not to get vaccinated, how will that affect the duration of this virus? And will we need to get a booster in the fall for those who did get the virus? So that's a two-part thing, right? It will absolutely affect the duration of this incident, because it will take us that much longer to get it under control. We may not ever get it under control. We may live with it for a really long time. But as far as the booster goes, you saw that 2 weeks ago, the CDC said, well, now we know that that the vaccine works for 6 months. Well, that's because they've been able to study it for 6 months, and it's still good for 6 months. So we expect potentially that they'll come out in another 3 months and say, okay, the vaccine's good for 9 months, or they won't. They'll tell us, okay, it's 6 months and now we'll get a booster. But we have to wait for those studies to come out to tell us how long it will last before we need to take that next step. And that's what we're waiting on. So far, the vaccine's doing a really great job. It just is. I mean, with all the data we're seeing, everything's doing fine. So they are working on potential boosters, but as of right now, it's doing really well. So there's more studies that need to be done. All right, so FEMA will be using recently evacuated returned Peace Corps volunteers to assist with vaccination efforts for certain areas. Maybe we are an area hit hard enough to qualify for that assistance. I am a returned volunteer, not a recently evacuated one, but just thought maybe we could reach out to FEMA to see if our county could qualify for that help. So I will tell you that FEMA Region 5 is in the state EOC, and they are very, very aware of what's going on in our county. We are working with that staff on flooding issues. So we have had conversations with them regarding COVID as well. They are intimately aware with what's going on in our county. And if we need to bring FEMA in, that will be a state decision that will be influenced by what Doc and I tell the state EOC.
And I'll just say, Justin and I have been talking. Believe me, it's not that we haven't asked. We do need human resources here. Clearly, yes. It takes people to get vaccines in arms. It takes people to help with our healthcare staff that are struggling. We have asked for human resources, and we will continue to ask for human resources.
Yep. So if I got COVID 9 days after my first vaccine and then got the BAM infusion, when can I get my second vaccine? And I think Doc answered that. You have to wait 90 days. Yep. Hi, Sandra. If someone has received, oh, there you go. They already answered that for you. That's the 90 days. Mm-hmm. So, Christina Johnson. So, are they closing anything else besides schools? We answered that one, correct? So we did. Yep, nobody.
We did that one.
The other question is how much transmission is due to the schools, and I'll say probably not a lot of transmission due to schools, but a lot of transmission due to school-aged kids and school-aged people. Right. So that's a tricky question. A lot of people who are getting COVID are not testing and are not reporting. All we can say is what we know from talking to our school administrators. They know when people are sick because of their absenteeism rates, which in many cases are beyond what they could adequately function in a school setting. So those decisions go very heavily into our decision to say we strongly recommend, because a lot of times there's just not a lot of parents are not sending their kids to schools when they're high transmission. So it's become a functional issue once again, operational issue.
Justin, did you read Andrew's question?
Let me look here, Andrew.
I do not see. I'm having technical difficulties.
This next one's a really good one though, because
Yeah,
it comes up a lot. It says, Dana says, if we are living with someone who's positive and we cannot isolate from them, and then I have a test negative soon after he tested positive, should I retest before my quarantine ends? So the real issue is if you need to quarantine for 14 days, and as you know, we had 10-day options, but we're encouraging the full 14 days now, especially with this variant. The variant doesn't go away as quickly. It stays contagious longer, at least 3 days average longer. So 14 days is important with the variant, okay? If you're living with somebody, your quarantine starts on the first day, on the day of your last exposure, okay? So if you're living somebody who's got COVID, they're infectious for 10 days, and you're living with them, your quarantine doesn't start until day 10 of their isolation period. It means it's 24 days, people. That's a lot. I get it. But testing does not get you out of quarantine. Okay, just like testing doesn't get you out of isolation, because the idea is if you test negative on day 4, there's nothing to say you're not going to be positive on day 6. So that's the unfortunate truth of quarantine. It can really drag on a long time. Best advice is probably to try and separate yourself from a person who has COVID, so that the first day of your quarantine day is a little earlier on their course of their illness, if that's possible. If not, you're all just stuck together and do the best you can. Hope you all get along well.
So the governor has said the key is now vaccinations, not lockdowns. With only 20% of our county fully vaccinated, how do you expect to get ahead of the growing case numbers and rising deaths, especially when full immunity doesn't happen overnight and people are refusing to get vaccinated? You mentioned you were late in vaccine rollout. Why? So let me answer the last question first, and then I'll let Doc talk about the medical side. So we were late in vaccine rollout because, unfortunately, we were one of the smaller counties, and vaccine allocation got to us later than it got to some of the larger counties. That's just a numbers game. We got a very small allocation, while some of the larger counties got a much larger allocation. It's just due to a numbers game. So then I'm going to push it to Doc, and she can answer the
we've used every vaccine we got. We just, proportionally, and we didn't have large hospital systems setting up community-based clinics. There was a variety of things. I think the real issue, though, is our community doesn't really love vaccines a lot. So here we are, sitting on vaccine, and we can't even fill our clinics up, okay? So there is a general vaccine hesitancy in our community that's making it difficult. Now, go back to your question. How do we expect to get ahead of this? I pray a lot. We're trying to get a lot of our community partners to help us. We expect individuals to reach out to other individuals. A lot of people that don't believe me, they're not going to believe what Justin says. They don't believe what the CDC says, but they're going to believe what their mom says or their auntie says or their neighbor says. So we want people who have been vaccinated to spread the word that it's a good thing, that they should do it, that they'll get a hug if they get vaccinated. I don't know, whatever it takes. But we're not going to give up. We have to just keep trying. And I think I share some of your skepticism and your pessimism, but it's been a long year, and I'm going to try and take a break and rejuvenate a little bit. But we can't stop trying. We just can't stop trying. It may not happen during this surge, but hopefully we'll have the rest of the summer and the spring to kind of catch up and get it done so that our next surge isn't as bad. That's what I'm hoping for.
Factories are full of COVID right now, and they cannot follow guidelines. Why are they open and putting employees at risk? Also, with the case numbers going up, shouldn't long-term care facilities be testing weekly? So I'll take the second part, and then Doc, you can talk about the factory. So
All right.
case numbers going up, shouldn't long-term care facilities be testing? So I will tell you right now, we don't have a single case of we have some employees, but we don't have any residents in any of our long-term care facilities right now that are sick. So there's really no reason to be doing any testing in our long-term care facilities, save potentially some of the employees. But we're working through that right now. I know the health department's working through that. So Doc, I'll send it back to you for the factory.
Yeah,
issue.
there are policies in place that they do have to test, actually. And I think our facilities are testing, and I forget where the protocols are, but we do have weekly meetings, actually monthly meetings now, but with the long-term care facilities, and they have testing supplies, and they
Right.
are supposed to be testing. So I don't know if we have 0 cases. I think when we have this much transmission, but I have to agree that our long-term care facilities have really not been on our radar for the last couple of weeks. We've had a lot more outbreaks with sports teams and more younger things. Now back to the question about factories and industrial units. So I mentioned Blue Meets Green and the EDA working with us to try and support vaccine clinics within industrial settings in workplaces. They're going to town. They're doing a bang up great job. Here, I'm just going to say this. I don't know how to control people's behavior. I've come to the conclusion that it doesn't matter what I say or how many people say it. There are people who are not going to follow our advice, or people just being confused about the same thing we've been talking about for a year and still not doing it right. I don't know what more to do. We're going to keep trying. But the solution here is for those employees to get vaccinated. Okay, that's the solution. So if you can't control your employer's behavior and you need that job, you can, of course, complain to us and we can move it up to MIOSHA and we can go through all that thing. But the next step is to get vaccinated and protect yourself. And protect yourself when you're in the workplace. Wear your mask, stay away from your coworkers as best as you can, and take advantage of your sick time if you feel you're sick. This is a very difficult situation. We're getting complaints every single day about workplaces. And there's just, I don't want to say there's literally, we're doing the best we can. I really don't think that's going to be the solution to mandate and legislate behavior in the private sector and the workforce. I don't think there's any political will to do it. And honestly, I don't know if there's any realistic ability for us to do that. So protect yourself, do the right thing, and get yourself vaccinated. And we'll hope that that word gets through. Dr. Mercatante mentioned 10-day quarantine periods. I said 14 days, and I apologize. 14 days is where we want to be right now with the variant. 7-day and 10-day options are on the CDC website, but they're not for us right now. They're not for us right now. We want 14 days. Please.
Yep.
Any
All
more
right, I'm
questions?
trying to find them. Yeah, there's a bunch. So yes, Andrew, that is correct. It's 15 minutes within a 24-hour, 15 minutes face-to-face within 6 feet, masked or unmasked within a 24-hour period. I'm COVID positive and health department recommends me to get the monoclonal infusion. Is that risky?
No, it seems to be a very safe treatment. It is only available for individuals who qualify, so you have to fall into certain risk categories. So if you're not sure what those are, our staff will walk you through that, or your doctor can walk you through that. We have had very, very few problems with this, but it's most effective if you do it within the first, in fact, you have to do it within the first 10 days, and the sooner you do it, the better. It's not a guarantee, but it has seems to be helping prevent some people from getting hospitalized.
And she later states that her PCP has already sent the papers in. So yes, Crystal, I would go get it done.
And if it were me, in fact, I had a family member recently get COVID, and I bent over backwards to get his monoclonal treatment started. So yes, I think it's worth it. Okay.
Julia asks, where can my grandfather get a test? Like we said, the health department has a satellite testing facility in Marysville. You can also get a test at Lake Huron Medical Center. You can get a test at in Fort Gratiot at the urgent care clinic there. The name is escaping me right now.
It's on our website. Go to our website, SCC, because it does change. We have a test finder, and it should be pretty straightforward. scchealth.co. You should be able to find. And I gotta admit, with the surge, more people are getting tested, and there's a little bit more of a delay.
That's true.
As more people get scared, it's gonna get a little harder. But do try and get tested if you're feeling ill. It does help. I don't know why urgent cares. I don't know why PCPs are doing what they're doing. They know the guidelines. They know what we know, and some are just choosing to follow it, and some are not. We do the best we can, trying to keep them updated. If you have specific concerns about a place, please submit your complaints on our website, and we look into every one of them.
Yeah, especially the last part of that email where it talks about some sort of discrimination. Please let the health department know that.
So if you don't have a family physician and you're sick, it's going to be hard to get a treatment. There's no standing orders. We really don't know, other than the monoclonal antibodies, we really don't know how to treat people if they're not sick enough to be in the hospital. There's a lot of discussion about that. So the issue of should you be on, quite honestly, it's a viral infection. So early on, a Z-Pack and a steroid pack are not going to probably do anything. It is a clinical decision that needs to be made by a doctor who understands your condition, if you're wheezing, etc. Your best bet is to go to an urgent care and be evaluated by a licensed provider.
I'm finally seeing the questions.
We are leaving. Okay, why are you leaving the decision to pause in person up to each school? They are getting so much negative feedback because each school has a different, unique environment. And actually, their boards of education do have the legal authority to do that. So we work with them closely. We try and convince them. And let's face it, if they try and run an in-person program, in-person learning, and their kids come in and they start having positive cases with quarantines, they go to remote just like everybody else. And that's really what we're trying to do. I've said this to our superintendents, and I'll say this to all you guys. We got to live with this virus. So we shut down in March. We're all scared. It does work, but the fallout from that, the event, the things that happen as a result of a complete shutdown, in some cases are worse than the virus itself. So what we need to do is find that balance. If you have a facility, a educational process, and everyone's doing fine, and they're coming in with their masks, and they're coming in and they're being tested, and you don't have a lot of disease transmission, great. Okay. If you do have problems, if you're not following mitigation strategies, you're getting cases, and every case is resulting in 20 quarantines, and you got teachers, then you can't do it, and you're not going to be able to do it. So that's where our guidance comes from, and they call us, and they know. Your schools know when they can't function in person. Believe me. So I don't think it's a blanket. Do this. Everybody hunker down. I don't think we can do that as a society. It's too damaging.
I can see a couple questions now, and we're almost out of time. So I'll just read a couple more, and then we can do closing comments. What about the vaccines for the homebound?
Working on it. We should have a lot of that worked out by the end of next week. So if you are homebound and really feel like you cannot ambulate to a clinic, we're going to have some of these drive-through clinics, but send your name in to us, please, at COVID-19. We've got a list, and we're working on trying to find some providers to get to your homes to vaccinate you. So if you want to be on that list, send us your name.
Do you see that question? Can I donate blood today if I receive my first Pfizer dose?
I don't see why not.
Yesterday. Yeah.
Okay. All right.
Don't donate blood if you're feeling ill. Okay, that's the only thing. So we know that you can get kind of a 24 to 48 hour post-vaccine blahs, sore arms. But if you're feeling feverish and yucky, you probably shouldn't donate blood. But if you're feeling great, there's no reason why you can't donate.
What's the age range of death in St. Clair County?
Oh, where's Brandon when we need him? I can't remember what the young end. Do you guys remember what the young end is? I think it's like 30.
I thought he said
It was 35
38.
or 34.
38-year-old.
Up to, you know,
I was
the
close.
80, 90
70
range.
plus.
Yes. Thank you.
Okay. The other one was.
And Jackie, we weren't
it.
trying to make you wait. Sorry.
Yeah, sorry about that. Why doesn't someone do something about all the bars and restaurants overcrowding?
So I'll answer that one. I got that one. So it's really difficult to do that county by county or region by region unless you're the governor, right? So doing that, making those sorts of decisions without the title governor and the authority of governor or a state of emergency at that level, either federal or state, you're really doing it without a lot of teeth. You don't have that authority behind you. You don't have that jurisdiction. So all those restaurants are businesses, and they need to keep going to make money for their employees to put food on the table, and for those businesses to keep operating and to be able to employ their employees. Now,
one of the things we will do is send a cease and desist order to a business or a restaurant that is not complying with the current epidemic order. So if there is a business that is not keeping this, I forget what's the indoor restrictions, restaurants have to have so much feet between them. Capacity can be, because it's the fire code capacity, so it can seem a little bit big. But if you're going to a place and they are packed in and please let us know. We will send them a cease and desist order. We can do that. What we can't do, I think, is just blanketly close everything, because Sanilac County isn't closing and Macomb County is not closing, and it doesn't function to do anything other than throw us in the courts and having lawsuits that we're probably going to lose. So we do want to work with people and make it work. The other thing I'm going to say is, God forbid, people, don't go. This is a good time to pause. I am strongly recommending to everyone to pause. Okay, this is a good time to get carry out, to have a barbecue in your backyard, and just let's pause. Okay, Ross, where's the picture, Ross? This is a dangerous time for us, people. So call in your order, pick it up, and take it home with you. Please don't be part of the problem. Be part of the solution. I'm really begging you guys. I mean this in all sincerity. I can't force you to do the right thing. This is very clear after a year of trying with all these finagling. We can't force you, but you can choose to do the right thing and get yourself vaccinated.
Thank you. Justin, any comments you want to say too?
Yeah. There's a lot of people that are struggling in the community, both being sick and struggling with what's going on around them. That's very clear. And I know not everybody agrees with what's going on. I know it's really hard for everybody, but we just need everybody to figure out a way to work together on this. We're living through a really dangerous period right now in our community, and it's going to take all of us to figure out how to work together to end it. So I just appreciate everybody working together. Protect yourself, and help protect your neighbors if they need some help. That's all I have. Have a good night.
And if we missed any questions, email them to covid19@stclaircounty.org.